who will share with us all about insemination. So, good morning, doctor.
Good morning,
Hello,
Doc.
good morning. How
Hi.
are you guys?
Breathe, my colleague. Okay, I'll start with the first question so you can breathe a little.
Thank you.
Okay, yes.
So, Dr. Arief, yes, Shahnaz did explain a little bit, like a little definition about what insemination
Yes,
is.
it's
But in
already-
medical
it's all
terms?
true. Yes.
Oh, it's all true.
It's true. Basically, we introduced the washed sperm, prepared sperm into the uterine cavity. Why? First, basically, we have to remove the toxin from the sperm, remove the bacteria and free radical.
Oh.
And then also to bypass the process.
Right.
Okay.
Because because in natural reproductive tract,
Yes.
Yeah.
there are acidic environment and then cervical mucus. Basically, it's to prevent the bad sperm to come in, but we have to bypass them, and then to shorten the distance.
Shorten the
Distance between the sperm to the eggs. That's the basic. Of
Right,
the
because
IUI.
some sperm are lazy. Is that correct?
Yeah, you can say that.
Lazy swimmers, that's what I mean.
Okay, only a hard worker can proceed.
Exactly.
Oh,
Only a
really?
hard worker can proceed.
Yes.
Okay, now can you explain to us the procedure of this?
Okay, basically IUI is quite simple procedure.
Okay.
But the important form of IUI is as simple as we talk. Just prepare the sperm
Okay.
and put it inside the uterus.
Yes.
Just like that. That's simple.
Oh, okay.
But the important is how the preparation,
Right.
how's the patient selection.
Okay.
First, the IVF, we cannot use IUI, intrauterine insemination, from the female factor, which has a tubal factor.
Tubal.
Because tubal, the fallopian tube.
Yeah, the fallopian
Yes.
tube is.
Because the sperm has to swim,
Swim up, right?
swim to the fertilization site. Because the fertilization happen in the fallopian tube, not in the uterine.
Yeah, yeah, yeah.
Okay, and the second, we cannot do insemination if we have a severe male problem.
Like
What
what?
is that?
If they have a severe oligospermia, if the sperm concentration is very, very low. Why? Because one of the requirements before we doing the IUI, at least after the sperm wash, we still have at least 5 million of live spermatozoa.
Right.
If it's less than 5 million, maybe we have to think other techniques,
Such as what?
such as IVF.
Oh, such as I,
Such
which
as
is the
IVF.
next step.
Yes, and other condition in female like severe endometriosis, then we have.
Okay.
Usually we use IUI. First, basically, they are both fertile, but we have maybe they have some sexual dysfunction, such as vaginismus.
What is that?
Is unable to do penetration because of involuntary vaginal contraction.
Oh,
It's very painful. It's lately I have quite patient with that problem.
really?
Yes, but
What is
sometimes-
causing vaginismus?
many things of many kinds of problems. Sometimes psychological.
Psychological.
Sometimes it's just happen like that.
Right.
Wow.
And other, if there's some male dysfunction,
Such as?
they can do penetration. I'm very sorry, maybe this is too.
No, it's
No, it's
okay.
okay.
You mean, yeah, I
Cannot
understand.
do penetration.
Right.
So sometimes you can help. Or sometimes infertile patient, but still in the early stage of infertile.
Infertility.
Basically, we divide the patient into 4 categories. First, young patient with good ovarian reserve, then much older patient above 35 with good ovarian reserve, and then much older patient,
Okay.
but with good young patient with diminished ovarian reserve, and the last one is old patient with very, very bad ovarian reserve.
Right.
See, so
In the first 3 cases, we can still use IVF. IUI.
Insemination.
IUI.
Yes.
But the last cases, the only choice is IVF.
You just use IVF.
Basically, in the IUI, we can do in normal cycle,
Yes.
which is we don't have to do any stimulation.
Right. Hang on. What do you mean by normal cycle, and what kind of stimulation also?
Okay.
Do you know?
We can do normal stimulation, natural without stimulation, I mean.
Okay.
We use
Just a normal
natural-
cycle, right?
Yes, normal cycle, but the patient has to be in the normal ovulatory state.
Oh, okay.
Normal cycle of menstruation. It means the length of the cycle is
Okay.
between 24 and 38.
Yes.
24 to
Days.
38,
To 38 days.
Okay.
Basically, all women should know,
Okay.
are they healthy or not?
Yeah.
Is the safest way, is the cheapest way sorry,
Yeah.
to know whether you are,
Yeah.
am I fertile or not?
Yeah.
First,
So-
just see your length of
So to do
cycle.
this IUI, do you have to be ovulating?
Yes.
Oh, okay.
We do
In that period of
in
time.
that period.
Oh,
of time.
okay.
Basically, we, in the natural cycle, first we see at the second day, and then we see again at the 10 or 11th day. If the egg is already quite ripe enough,
Yes.
it means more than 2 centimeter in from the vaginal ultrasound,
Yeah.
then we can do the trigger and then we proceed with the IUI.
How do you know when you're ovulating, doc? I mean, is there some sort of a test kit? Because when you're pregnant, there is a test kit for a pregnancy. But when you're ovulating, how do you know when that happens? You've done that? Oh.
The ovulation kit.
We have it.
Yes.
Ah, okay.
Yeah, today is more easier to know.
Yeah, right?
But basically, we can do many things we can know whether the woman is ovulating or not. First, we can see from the body temperature.
Yeah.
Right.
Yeah, but recently, if your fever, we might.
Yeah, usually it's like
Maybe
we
you're
get
with
panic and then it's
COVID-19.
like, oh, is it COVID? You know?
And the second, we can use the kit tools.
Yeah.
Yeah.
Okay.
And the third, maybe we can use the hormonal check and also the ultrasound.
The ultrasound. I
Right.
think it's more effective, right?
Yeah, more
Ultrasound.
effective. But for IUI, yeah, we use ultrasound because we have to know the size of the eggs.
What's the success rate of an insemination?
Insemination the success rate is depend on first on the age, on the body mass index, if and then the cause of infertility. First, if you're doing a natural cycle, the success rate of IUI is the success rate for live birth, not pregnant.
Yeah, live birth.
Live
okay,
birth.
live birth.
Because
Okay.
many term we have to see in.
Yes.
How many percent are they?
Is 17% more
17.
than natural process.
Oh, I see.
But if you use ovarian stimulation, the success rate is 14% in the stimulating one. The success rate is between 17% to 40%.
To 40, 40.
40%.
40%.
40%.
When you said about stimulation, what do you mean, doctor?
It means we guide the maturation of the ovary.
Okay.
So we don't leave, because sometimes if we leave it to natural, basically many things can happen. If the women too excited or the women is too stressed,
Yes.
it can change the pattern.
Right.
Really?
And also if the woman has other condition, maybe the BMI too big,
Oh, okay.
sometimes it's,
It's a
although
little
she
bit
has
hard.
a normal cycle before, sometimes it will change
Okay.
the
I
course.
see. So overweight women find it harder to conceive.
Yes,
Yes.
naturally.
All right.
Okay. Now, I also want to know, doctor, before we do the procedure, what should we prepare? Do we need to, consider our diet, sleep cycle, and everything?
Yes, first what we have to know is we have to be honest to ourselves what is our really problem. Sometimes some infertility, the problem is in the head. Are you
Really?
stressed?
Wow. Okay. So you need to meditate first.
First you have to know.
First, you have to know. Okay.
Some medication for that is meditation. Some you have to meet the professional.
Okay.
And then first you have to be in good condition in your body.
Okay.
Because basically reproduction is like a secondary function of your body. The first function is metabolism, how to produce energy, how to eat, everything.
Oh, okay.
If the main core machine is good, then should be the second function is also good.
Yeah.
So first thing first, you have to attend a very good, healthy lifestyle first.
Yes.
Lifestyle.
Yes.
And we can also help you with that. Sometimes we just know we're doing good, healthy lifestyle, but what kind?
Yeah.
Is it suitable for you? We know
Okay.
that.
Yeah.
Okay, maybe sometime they have to meet the professional for that.
Yes. So what about the diet? Do we have to modify what we eat, what we drink?
It depends on your body, basically. Sometimes if you want to attend that, okay, don't eat this, don't eat that, eat this. Is it suitable? That's the...
Okay. Sometimes you became too stressful.
Yeah,
right,
sometimes
because of that.
sometimes if you're doing diet, sometimes while you're doing diet, basically you're stressed.
Yeah.
Yeah,
Sometimes.
that's true.
I cannot eat.
That's why I don't diet, doc.
You don't need to.
I eat a lot.
Well, I did that, and
All right. But doctor, we also
Yes.
want to know, is it safe? The procedure, is it safe?
yes, it's quite safe.
It's quite
quite safe.
Okay.
Maybe at the first IVF, they don't do the washing. Maybe
Okay.
so many decades ago, they don't do the washing. Yes, it's still many toxin in there. So
Right.
after they introduce the sperm, the women feel very cramped
Wow.
Ah, really?
Okay.
at the first. At the
Ah.
first, many decades ago. I'm not talking right now.
All right.
Now it's
Oh,
very gentle procedure.
Okay.
it's a very gentle procedure.
Yes,
How long
very-
does it take, doctor, to have the procedure?
From the first selection, maybe
Yeah.
a month or two.
A month
month
or
or two.
two.
Sometimes in the first month, we do the initial
Preparation.
preparation. No, we do the diagnosing. What is the main cause?
Okay.
If it's if it's not appropriate for IUI, maybe we have to move.
Move to IVF.
Yes, because first now is the patient selection. Sometimes the patient selection maybe takes time.
Right.
Because for the sperm analysis, sometimes we have to wait for
Yeah.
a week before we have the sample. And to know whether the women has a good cycle, we have to wait for a month. We have to check on the second day, and then maybe at the mid of the cycle, is she ovulating? And then we have to know when the menses start also.
Oh,
Then we know
the cycle.
okay, the length
right.
of the cycle.
Okay. You can use an app tracker now.
Oh
Yes.
yeah, like
It's very
flow,
helpful
for
for me.
example.
Yeah, to know your cycle.
Yes.
Right.
Lately, I just asked, do you using
Yeah.
Yeah.
the tracker? Okay, I want to see the summary. Okay, so your length is like this. Okay,
That's nice.
so
Very
the
helpful.
Very helpful. So I can say, okay, basically you're not ovulating, so maybe the choice for you is this.
Right.
Okay.
So is there any, because we know that, well, the little information that we know about IVF is usually the woman who's trying to conceive is receiving hormonal injection.
Yes.
What about insemination? Do women need hormonal injections too?
Yes, with women with ovulatory disorder or with quite big BMI,
Yes.
body mass index, yes. We prefer to use a hormonal injection. Because in the hormonal injection, basically, we know the stimulation, it happened.
Oh,
Right.
okay. So you can monitor the size of the egg,
Yes.
right? Okay.
We can monitor the size of the eggs. After the 7th day, if the eggs is not quite big enough, we have to increase the dose.
Right. But it's not mandatory to have that injection.
No, it depends on the
It
patient.
depends on the patient's
on the patient.
health condition as
Yes.
well. Right.
Basically, we do that first. We try the natural one, and then if natural it fails, then we proceed with the help.
Right.
Okay. Now, can you share with us the price to do this procedure?
Well, the price is basically it depends on
Depends.
what kind of course that you have. First,
Really?
if you're using a natural cycle,
Yes.
that it means that you only do the initial check,
Oh, okay.
and then you come again at the middle of the cycle, and then you proceed to the IUI. Maybe it's quite cheap.
Okay.
Because IUI itself is not very expensive. The expensive one is when you have to undergoing the hormonal injection.
Okay.
So the
that's
price range would be from the cheapest to the most expensive?
Yeah, maybe not that expensive like IVF, because in
course,
IVF we
yeah.
control most of the cycle.
Right.
Oh,
Most of the cycle, and then we do the fertilization is outside the female body.
Yes.
We have to do the ovum pickup,
Yeah.
and then we met the
With the sperm.
with ICSI, and then we wait day 3, day 5.
Yeah.
Okay.
Is it good? We can proceed to embryo
Yeah.
transfer,
I see.
or we
So-
have to freeze it. Right now, we tend to do the freezing because it's more success rate
Yes.
than fresh IVF
I
right
see.
now.
And
A
the
lot.
price range would be?
With the laboratory test or without.
Okay.
With and without.
And without.
Yeah, if without, maybe range. I say maybe in the average.
Yeah, average.
Average maybe more about 50.
50 million
Without lab.
rupiah.
Yes.
50 million.
That's
Under
average.
50.
No, above.
Above. Okay.
Above
Okay.
50
Above.
million rupiah.
Okay. Now my last question would be, if some people want to do this, do you have any special tips for them?
First, you have to prepare yourself. Basically, pregnancy itself, it's not an easy part.
Yep.
Pregnancy, yes, I know. Usually, women try only to pregnant, but never prepare themselves to do the pregnancy itself. Because pregnancy is not one day. Pregnancy
Yeah.
is
9 months.
9 months. At the first trimester, you will undergo having nausea,
Yeah.
everything.
You go through
And
a
then
lot.
maybe a little bit holiday after that. And after 7 months, then you will start with the baby kicking. Maybe at
Yeah.
first you feel very, oh, yay, baby kick.
Yeah.
And then you cannot sleep
Yeah.
until your baby birth.
Yeah. And then the lower back pain.
Oh, yeah.
It's
lower
real,
back.
guys.
Yeah, I feel that too. When I'm helping, it's quite.
Yeah. Lower back.
Okay, what does it mean? It means you have to prepare your body first.
Yes.
Because with good preparation, it also helps you to gain, to conceive.
Yes.
Yeah, and then to do the pregnancy. Because if your body not ready, it's the pregnancy tends to have more complication,
I see.
like preeclampsia, diabetic in pregnancy,
Yeah.
and also the risk for cesarean delivery is also higher if you have weak body.
Right. Right.
So the point is, how do you prepare your body? And the more important thing is you have to know yourself, your spouse,
And your partner.
and how you're doing it.
Yes. All right. Well,
Thank
thank
you,
you so much, Dr. Arief Gazali, for sharing your knowledge on insemination. There you go. But now we're up for another break, right, Jonas?
Right. In the meantime, don't forget to follow our social media accounts if you haven't already. We're on Instagram, we're on Twitter, and also YouTube at CToday News. We'll be right back.